The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everyone, this is Jonathan Marks. Welcome back to Go to Health Media. Remember, you can watch us on YouTube. You can watch us on 8 podcast networks. You can also watch us on our website at gotohealthmedia.com, where you can subscribe so that you don't miss a show. Our mission is twofold: to educate the public with evidence-based health information from health experts, and to promote the expertise of health practices, nonprofits, and companies with multimedia marketing campaigns. So on to today's show. Imagine being an active weekend warrior. You love sports and recreational competition. You love an active lifestyle. Now imagine being sidelined with a chronic and progressive heart disease that causes changes in the heart muscle, leading to symptoms such as shortness of breath, rapid heartbeat, chest pain, feeling lightheaded, fainting, and fatigue. Terrible. These symptoms can increase with exertion and worsen over time, significantly impacting a person's quality of life. This is what happened to our guest today, John, a successful former business owner with a lifelong passion for playing competitive sports like tennis and pickleball. His worsening symptoms led to an eventual diagnosis of what's called obstructive hypertrophic cardiomyopathy, or oHCM. This forced John to sit on the sidelines. After talking to his doctor, John found a treatment that works for him, and he's been able to return to his love of pickleball, including his participation in a recreational pickleball competition open to the public. Good for you, John. Also with us today is John's cardiologist, Dr. Payal Kohli. She's a board-certified cardiologist currently practicing at Cherry Creek Heart in Denver, Colorado, where she's the founder and medical director. She is also an associate adjunct professor of cardiology at both Duke University and at Johns Hopkins University. She holds 5 board certifications and is an internationally recognized cardiovascular disease expert, delivering invited lectures all over the world. She has published in leading journals and has received multiple honors and awards. In addition to her research and clinical work, Dr. Kohli has made more than 2,000 television appearances as a medical correspondent all over the country. So welcome to the show, John and Dr. Payal Kohli. How are you today?
We're doing great.
I'm doing great. Thank you.
Good, good. So first, let me ask Dr. Kohli, what is symptomatic obstructive hypertrophic cardiomyopathy, which is oHCM? How does it impact people?
So symptomatic obstructive hypertrophic cardiomyopathy is actually a condition that we refer to as a great masquerader, because in 80% of cases, it can actually go undiagnosed or underdiagnosed, and it tricks patients, but also healthcare providers alike. So it's really important to be plugged into your body and plugged into the symptoms. And that's part of the reason John and I are here today working with Bristol Myers Squibb to really raise awareness of this disease, how it manifests, and what the treatment options are. So it's a genetic disease that affects the heart. And if you think about the heart, it's a muscle pump, right? It's pumping blood to our organs all day long. And when you have hypertrophic cardiomyopathy with obstruction, essentially what happens is the heart becomes stiff, so it's not filling normally with blood. So instead of a water balloon, you have a lead balloon, which doesn't fill with blood normally. And then that blood doesn't leave the heart normally, because the hallway that the blood uses normally to leave the heart becomes thickened and narrowed. So that blood has trouble getting out. And then you can imagine when you're exercising and you need the blood to get out faster and you need more blood to your organs, it's not getting out. So you can feel lightheaded or dizzy, like you're going to faint because it's not getting to your brain. You can get chest pain, chest pressure, chest tightness, or shortness of breath, even palpitations because it's not getting to your heart and lungs. So it's really important for you to not blow off those symptoms, because a lot of people have symptoms that are better on some days and worse on some days. So they say, oh, I'm just out of shape, or I'm deconditioned, or maybe I've put on some weight and that's why it's happening. And it's really important for you to make sure that you don't dial back your activity, which a lot of people do. They start doing less because they're not able to do as much. So it can really dramatically impact the quality of your life as well as the quantity of your life as well.
And tell us, how is oHCM diagnosed, and then how is it treated?
So essentially what tips us off to diagnosis is usually symptoms, but sometimes we'll get a diagnosis based on what we hear, which is a murmur, a musical sound that the blood is making as it moves through the heart. Sometimes we'll get diagnosis based on an EKG, which is the electrical pattern of your heart from the outside, because that looks funny, because the structural changes can affect the electricity that's running through the walls of the muscle. But the most common way to diagnose it if you have symptoms is to get a test called an echocardiogram, which is an ultrasound of the heart that looks at how the heart looks. Is it stiff? And is the blood having trouble getting out? Sometimes we'll get a cardiac MRI, which is kind of a zoomed in version of an echocardiogram, gives us a little more focused detail as to how that blood is leaving the heart. So that's the imaging test that we usually get. In a lot of patients, we'll also get genetic testing because it's a genetic condition. So if you have a family member who's affected, that obviously makes your risk higher, and you check the genes, but you can even get it as a spontaneous mutation. So just because you don't have a family member who has it doesn't mean you're in the clear, because your gene could have spontaneously mutated. And if the genetic test comes out negative, it also doesn't mean you don't have it, because there are many more mutations out there that we haven't quite identified for it. So it's a combination of that, the symptoms of murmur or the EKG triggering an imaging test like an ultrasound and an MRI. And then sometimes we also add on the genetics.
Got it. And John, can you please share with us the symptoms you experienced personally and how you came to be diagnosed with oHCM?
You bet. Well, first of all, I really value being an active person. I played college tennis back in the day, and I've always been a believer and practitioner of staying fit and getting after it every day.
Good for you.
Interesting that both of my brothers and myself were all misdiagnosed with a heart murmur when we were in our 20s. And all three of us would eventually be diagnosed with oHCM when we reached our 50s and 60s. And Dr. Kohli mentioned the genetic markers. None of us had a genetic marker, and there's obviously a gene that affects us all, but we do not have a marker that is identified as one associated with oHCM. But anyway, my symptoms, they started in my 50s. It started slowly. I just started getting dizzy when I started working out or going on a walk. And then I developed other symptoms like feeling faint. And eventually it became very difficult to even go on a simple walk without needing to constantly stop and catch my breath. I switched from tennis to pickleball, thinking that might help because the court's smaller, but that didn't work out very well for me either. I really struggled with that sport. These symptoms continue to interfere with one of the things that I really enjoy the most, and that is being physically fit and active every day. Eventually, I saw a cardiologist, and then I was diagnosed with oHCM about 3 years ago.
And how were you treated for the condition, and what kind of impact did your treatment have on your symptoms?
So I'm a real success story, I think. And for the most part, I was treated originally with a beta blocker, as Dr. Kohli explained. It didn't really work that well for me. So then my doctor prescribed Camzyos for my symptomatic oHCM. And that did relieve many of the symptoms. Much of the symptomatic stuff that was going on with me was minimized after about 3 months of use with that drug. And I was delighted that I could even play pickleball again. My friends even noticed the difference in my play and my stamina. So my symptoms today, as of today, really like the shortness of breath and feeling faint is much improved. I'm even competing in amateur pickleball tournaments here in Wisconsin and down in Florida. And that's so important to me because I thought my days of being physically active, frankly, were over. And so, others may experience different results. But if you're experiencing symptoms, these types of symptoms that we're talking about today, it's important to go see your doctor. Early diagnosis and Camzyos for me made a difference in my symptomatic oHCM.
Great. And John, have you returned completely to an active sports life?
Yeah, I may not be quite as active as I was, but I'm feeling, I mean, I'm very satisfied with my therapy that was prescribed by my cardiology team. I live an active life. I go on walks and bike rides with my wife. I'm able to play a nice game of pickleball still.
Good,
So things are good.
good.
Yeah.
And what has motivated you to share your story today, John?
Dr. Kohli and I are both here to raise awareness about this disease. I mean, as I believe Dr. Kohli stated, there's so many underdiagnosed or misdiagnosed people like my brothers and I. And it's important that others, hear this message, go out, hopefully get diagnosed. If they are if they do have oHCM, get after a regimen as prescribed by their cardiology team.
Great. And Dr. Kohli, if I can ask you, what is Camzyos? Tell us, and how does it help treat heart disease?
So Camzyos or mavacamten is an FDA-approved drug that we now have in our toolbox as a way to treat obstructive hypertrophic cardiomyopathy. And the problem is the heart is squeezing too hard and it kind of closes in on itself. So this reduces the force with which the heart squeezes so that you really do allow that hallway and that heart to not kind of collapse on itself and let the blood out more. So that's how that medication works. And it's sort of a first-in-class medicine. We haven't had this type of a medication before to treat obstructive hypertrophic cardiomyopathy. Now, in addition to treating the symptoms that John is having, there are also clinical trials ongoing to think about whether we should actually treat the heart failure that's a result of obstructive hypertrophic cardiomyopathy. Because if the blood's not moving forward, it's starting to back up, right? And that can cause stretch on the chambers and a clinical syndrome of something called heart failure. It's a type of heart failure where the pump is not working efficiently. So there are medications like SGLT2 inhibitors that we're looking at to see if that can help improve. And then the electricity runs through the walls of the heart. So if there's disarray of the heart muscle, it's thick and it's dysfunctional, the electrical cables actually get irritated and they get scarred. And so they can start to act up and you can have sudden cardiac death where the heart stops suddenly. So it's really important for us as physicians to try to figure out if we can predict the future. Who is at risk for having their heart stop suddenly? And those are the patients that we actually treat with something called a defibrillator, which is a device that we put inside their chest with a wire. In case the heart stops, it shocks it right back into a normal rhythm.
And is what you would call, this might seem like a foolish question, but just so people know, is John cured at this point, or is this a chronic condition that he needs to stay on top of and keep taking medications?
Sadly, he's not going to be cured. It's a chronic condition. And so you can't change the structural changes back. You can't reverse how the changes are. You can just change the behavior so that the hallway is not narrowing in a dynamic fashion. As it squeezes, it narrows more. So that's what you're preventing. So you're treating his symptoms essentially with Camzyos. You're not actually changing the genetic changes that he has. And over the course of his life, it's going to be really important for us to monitor him really carefully because the disease can be progressive. So just because it looks this way today and he's responded to treatment doesn't mean that muscle won't get thicker, that heart won't get stiffer over time. And we're going to have to keep checking on his heart with those ultrasounds or those echocardiograms and keep making sure that he stays active so that we know if he starts to have change in his symptoms, because that's going to prompt a change in treatment for us.
Great. So I'll give you a second to think about this. I'd like to ask as a final question, what's a message you'd each like to leave with our audience today? But before I do, let me just tell people where they can go to learn more, which is camzyos.com. And let me spell that. It's C-A-M as in mother, C-A-M-Z-Y-O-S, C-A-M-Z-Y-O-S, camzyos.com. So, John, what would you like to leave people with a message today?
I would, if you have these symptoms and you are diagnosed with oHCM, there's still hope. I mean, people with this disease live a very long life still. It's not a death sentence by any means. People live a long life with this disease. For me, oHCM has made a difference in my symptoms. And go out and, if you have these symptoms, please, see a doctor.
Thank you. Thank you. And Dr. Kohli, what message would you like to leave with people?
I always tell my patients, you're the captain of the ship. And I'm just one of the crew members. So it's really up to you to be your own best advocate, whether that's advocating because you're having symptoms or advocating for prevention, because I'm a huge believer in prevention. And I think if we start to prevent heart disease in our 20s, 30s, and 40s, we age better, we live better. And the goal of life is not just lifespan, it's health span. We want to age better, and we want to make sure that we reduce the problems that are usually associated with old age, like heart attack, strokes, dementia. And by controlling our risk factors early in life, we can do that. So really make sure that you know your numbers, you know your risk, empower yourself about your health so that you're in charge of making sure you're staying on top of it and you can really age better.
Beautiful messages. Thank you both. I'm so happy to have met you today and so glad you're getting this message out. We've been talking with Dr. Payal Kohli. She's a board-certified cardiologist, currently practicing at Cherry Creek Heart in Denver, Colorado, where she's the founder and medical director. We've also been talking with John, who's been a successful business owner with a lifelong passion for playing competitive sports. He got worsening symptoms with his heart, and he got them taken care of, and he's now back and playing sports and active again the way he's always wanted to be. Thanks both for being with us today, and thanks everybody for being with us. This is Jonathan Marks with Go to Health Media. We've just passed 1.4 million downloads. We thank you for your interest and following us. And remember, as we say at the end of every show, go to health. Thanks a lot. Take care. God bless. Bye-bye. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.